I'm Brandon Staglin. Thank you for watching and joining us. And feel free to drop questions for us in the Facebook Premiere chat when this premieres, and we'll do our best to answer them online. I started this webcast 9 years ago as a means to help the public know about the importance of brain health science to deliver better treatments for people who are struggling with mental health challenges, and about the amazing discoveries being made every year toward this end. And I also wanted people, especially those who struggle with mental health, to understand the very real prospect of recovery as modeled by those who have recovered and are now living well. Today we'll continue our conversation about managing mental health during the coronavirus pandemic, as we have on the past several episodes. And, as the pandemic continues to take a toll on everyone's emotional well-being, there's become to be a rising tide of depression in our society. And that may be our greatest mental health challenge in our society today. Depression is one of the most common mental health conditions. Symptoms of depression that people experience include things like not only profound, prolonged sadness, but also disruptions in sleep, in appetite, in energy, focus, and even in the sense of self-worth, which can be very debilitating for people. I've experienced this myself with my schizophrenia. It's been a component of that for me, and I've benefited from treatment for it. The World Health Organization estimates that 264 million people worldwide are living with depression today. And that's around the world. And the National Institute of Mental Health estimates there's about 17 million people in the United States who deal with depression. So it's very common. If you have it, if you experience it, it's something that you're not alone with. And these figures are before the arrival of COVID-19. So it's likely even more widespread now. It's also one of the most complex mental illnesses to understand, arising from a variety of factors like the social factors, environmental, biological factors, and these include things like stressful and adverse life events, which we're all experiencing to some degree right now. So joining us now to discuss this parallel pandemic of depression and how we can address it in society through science and policy innovations are two amazing guests, thought leaders in their fields. Dr. Laura Lewis is Assistant Professor of Biomedical Engineering at Boston University. She's also a 2019 One Mind Rising Star awardee, sponsored by Bettina Bryant, in her research to understand better the intersection of sleep and mood in depression. The Honorable Patrick Kennedy is also with us today. We're very lucky to have both of them here today. Patrick Kennedy is the co-founder of One Mind and also founder of the Kennedy Forum, an advocacy organization that works in public policy to improve mental health care and access to care. He's also a former congressman from Rhode Island. And in that position, he was the principal architect of the Mental Health Parity and Addiction Equity Act of 2008, a landmark legislation to improve insurance coverage for people with mental health challenges. Laura and Patrick, thank you so much for being with us today on Brainwaves.
Thank you so much, Brandon. It's really an honor to be with you and to have been a friend of yours, and along the way, all in the advocacy movement. You are a soldier, an absolute soldier in this movement. You've never given up, and you just keep moving forward. And this is before anyone was kind of talking about it in the popular culture. You were out there talking about your own lived experience. And then this is a great modern day opportunity to get the word out. And I salute you for doing it. And so thank you so much for that.
You bet, Patrick.
Yes, thanks so much for having me too. It's been really wonderful to work with One Mind and see the amazing work you guys are doing.
Well, thank you, Laura. Likewise, I'm really impressed with your work too, and we'll talk some about that today. I look forward to profiling you on this webcast. Thanks to you both. Laura, I'll start with you. Mm-hmm. You had a research lab at Boston University doing innovative work on sleep, the intersection of sleep and mood and depression. What made you choose to study this area?
Yeah, so where the perspective I was coming from was originally as a sleep scientist. So working on, the profound effects that sleep has on really very many different aspects of brain health. And it became clear to me that, sleep is still a very surprisingly mysterious thing that we do, but it's so important also for so many aspects of cognition, of mood. And what became particularly intriguing is, I think we all kind of know from introspection how important sleep is for our emotional health. Bad bad night's sleep can make you feel really badly, and a great night's sleep, you can wake up feeling refreshed. So I think we all have that intuition. But what's been really interesting is this increasing realization that this relationship is bidirectional. Your sleep affects your mood, and your mood affects your sleep. And so that made me become very sort of interested and very hopeful about using sleep as a potential tool and kind of lever to start to understand how mood is regulated in the brain.
Fascinating. It goes both ways. Well, to expand on that, you found in some earlier research that sleep deprivation can actually improve people's mood counterintuitively, and what have you discovered about that, and how can we harness that phenomenon to perhaps help people with better treatments for depression?
Yeah, absolutely. So there's in almost all scenarios, sleep deprivation is bad for us, right? So if we don't sleep well and we don't have regular sleep, we know that this can have really negative consequences. But there's actually surprisingly long history of studies, from many different labs actually, showing that there's this very counterintuitive and striking effect that can happen in people with depression. And that's that for people with depression, for about half of them, if they were to stay awake all night long, they'll actually rapidly begin to feel better. That's really incredible. Also, just the time scale that happens on, that just kind of a few hours could have that effect. And it is really surprising to us that although in general sleep deprivation is negative, there's this kind of one scenario and one group of people who seem to briefly benefit from it. So it's very intriguing, but it's not really viable as a therapy right now, because people can't just not sleep, and there's all other kinds of negative consequences to not sleeping. And so what my research is doing is trying to use this as an opportunity to say, given that we know that there's something that can so profoundly affect mood and so rapidly affect mood, we want to take some new kinds of brain imaging technologies that we've been working on to understand exactly what's happening when that happens. Our goal is both to understand, why does this affect half of people depression and not the other half? So are there actually maybe two different syndromes that have kind of two different brain origins? And secondly, could we see what's happening? Could it, for example, be that there's kind of mini sleep episodes that actually have a beneficial effect after sleep deprivation? And if we knew how that worked, then that would also give us ideas about how to move forward and potentially trying to kind of modulate and improve the outcomes.
That's so fascinating. There's a lot of potential there to actually help people based on what's happening in the brain when these sleep effects take place.
I really hope so. People have such unique, different sleep profiles. Everyone sleeps differently, and I think that there's a lot of information embedded in that. The same brain we sleep with is the same brain we're awake with. So, I hope that thinking about how sleep affects brain health could also, kind of illuminate new routes that we could take to try to improve it.
So innovative. Thank you for your amazing work there. Patrick, why did you've been a champion of improving mental health for people over a long period of time, many, many years. Why did you decide to start the Kennedy Forum? And why have you focused your advocacy on brain health and mental health in our society?
Well, I thank you, Brandon, and thank you, Laura, for your great work. I love people who research the brain and who are identifying the future therapies and treatments that are going to change the trajectory for so many millions who are suffering from these illnesses. And I love the fact that you're talking about, segments of those with these mental health disorders, because as we know, depression is a spectrum, like autism is a spectrum. And all of these heterogeneous illnesses are made up of multiple factors. And I love the fact that if we can start isolating those, quote, mechanisms of action and start putting operative kind of interventions in place, both, behavioral as well as chemical, we can really turn the corner on the huge disability that results from depression in this country. So awesome what you're doing. And I started the Kennedy Forum because I knew my last name worked. I got elected. It had nothing to do with my last name being Kennedy, as I like to joke, everything to do with my great personality. I started it on the anniversary of President Kennedy's signing the Community Mental Health Act, because that was like one of the last major policies, aside from the great initiative that the Carters had undertaken in the Community Mental Health Systems Act, both of them were about building out a comprehensive safety net of prevention and treatment and recovery for people with mental illness and addiction. And frankly, what he said back then is true today. You need all aspects of treatment. And so that's why it's called, the Community Mental Health Act, not the Psychiatric Mental Health Act or the Psychiatrist or the Pharma Mental Health Act. This is the Community Mental Health Act, because one of the things we've never gotten right in policy making is the fact that mental health is part of our education system, it's part of our criminal justice, it's part of our housing system, it's part of our labor system. You could go right down the line. It's frankly an issue that should be in every single committee in the United States Congress, but I guarantee you, having served there myself, most members of Congress don't know that they could do something to address this public health crisis in their committee. But no one's pointed that out. And I don't think it's for lack of will in terms of them wanting to do this in many instances. It's that they haven't been given the roadmap. So One Mind is the roadmap for neuroscience, because it's talking about open science, it's talking about collaborative, major big data. How do we, identify systems analysis, at the genome, proteome, metabolome, phenome? How do we integrate all these systems, develop the science, and so that it's common data sets, and we can actually learn something because the science is replicable, and we can have confidence in the science. So I have been enthusiastic like you, Brandon, in terms of getting this whole space move forward, and it's only going to come when Congress spends more money researching the brain and more money treating those with brain illnesses. And so that's really been the initiative at the Kennedy Forum, along with One Mind.
Yeah, thank you, Patrick, for your amazing work there to help Congress understand the need for better mental health care and how to do it. And some of this comes from some of the inspiration for this, I think, comes from your personal experience. You've been very open and honest in your public speaking, and your amazing memoir, A Common Struggle, which has helped so many people, about your challenges and your struggles with addiction and depression. Thank you for sharing so openly. What factors have led to help you? What factors have been most helpful to you in overcoming your struggles with addiction and depression?
Well, like I say, I never chose to be a leader in this space. The guy that I was in drug treatment with wrote about being in treatment with Representative Kennedy, and it was in the National Enquirer. And so I was hoping to keep this a secret, Brandon. I was really wanting, and I wish none of you knew about the fact that I have a mood disorder and suffer from chronic addiction and alcoholism. Everything in my being and how I grew up screams out, please be quiet, don't talk about it, no one find out about it. That's been my inside mantra. But because I'm an advocate, and that only happened because this guy outed me in drug rehab, I ended up signing on to the parity law. And that I never would have done had this guy not ratted me out by telling everybody that I was an addict. So stigma is the biggest barrier by far. But also, even if I were to break down stigma, the ability for people to gain access to treatment is near impossible, even for people with resources. So I'd say for most people, it's the fact they can't even financially gain access to resources or don't have any kind of navigation for them. But I would say that a lot of people don't even begin to seek help because of the worry and what people will think of them and that sort.
Yeah, that resonates with me and so many people too. So it's so wonderful you have spoken out, and you've been a beacon for so many people, and not only the work that you've done in advocacy, but also as an example of somebody who has succeeded and is now doing amazing work to help others after overcoming his own mental health challenges. So thank you, Patrick. It's amazing. What is the current, and I was asking about some of the supports that have helped you overcome those challenges. We may have seen one of those supports that just kind of pop in a moment there.
Yes.
In the frame.
Yes, yes.
I think for me, family's been a huge benefit for my mental health, and the support of my family's just been so instrumental in it.
Here. Come. Yeah, yeah. So look at the camera, let everyone see. See that face? Yeah.
Hi.
So, thanks, buddy. It's a lifesaver. He and his siblings are lifesavers. My wife is. My wife understands this illness, so she lets me go early in the morning to my 12-step meeting. Never complains about it. Never says, "Oh, I wish you had done something different." It's like I'm so lucky. My wife doesn't allow for any alcohol in the house unless it's Staglin, but only then does she use it for to re-gift to other people, because they all love Staglin wine, and whatever we get, we give to friends. So needless to say, I'm very blessed. I have a very good support system. Peer support is crucial to me. But I'd also say I have an ASAM certified psychiatrist, which means my psychiatrist knows about addiction too. And I would caution those who have mood disorders, who also have addiction, that it's really important for your psychiatrist to also understand your addiction, because a lot of regular psychiatrists inadvertently sometimes contribute in a harmful way when they prescribe certain medications to our addiction problems. So I have an ASAM psychiatrist. I have a great 12-step recovery program and as I said, peers in that program that support me. And I take medication for my mood disorder. I take anticonvulsants. I take lithium, which is commonly prescribed for those with the bipolar spectrum. So and as you know, we're playing chemistry here. We're trying to figure out kind of what works, because we're doing the best with what we've got. And if we get more science, we'll get better targeted therapies down the road.
Yeah, that's the goal. Thanks for going over that with us and for sharing that. It's powerful to hear your story. What has the current crisis in the pandemic taught you about the needs in our society to improve mental health care and the opportunities to do so?
Well, unfortunately, if we thought that we got caught flat-footed with COVID-19, which everyone I think would safely agree that we just totally missed the boat in our response to this pandemic, we have a chance now to build the levees, to reinforce all of the sustaining walls of our mental health system, to brace for the coming tsunami of overdoses and suicides, let alone epidemic of depression and anxiety. But we risk falling victim to another response like COVID-19, where we're caught without the needed resources. And we all know how we're scrambling around for PPEs, and everyone knows about the ventilators. Frankly, we need to get the equivalent of those ready for this upcoming tsunami. If we already had 130,000 Americans die of overdose and suicide before COVID-19 hit, just imagine what's coming after COVID-19 hits. It is remarkable to think about the fact that we lose every year, including this year, twice as many people to suicide and overdose as we lose to COVID-19 this year. As bad and awful as the 50,000 plus deaths are, they're still less than half what we lose to suicide and overdose. I'm saying that for your viewers because I think people are unaware that we had a deadly epidemic already going before the pandemic of COVID-19 hit. And Now that's been obscured because of our attention towards, understandably, the virus. But we're flattening the curve, hopefully, and hopefully we'll get the vaccines and all the rest. But then the challenge will be, how do we flatten the curve of suicides? Your father, Garen, wrote a great op-ed that I quote all the time about flattening the curve, but this time applying it to overdoses and suicides. That needs to be our future challenge, but we need to prepare now.
Absolutely. Here, and we'll touch base about that again later in the interview. Thanks for going over that. So important. Laura, you have made some great discoveries so far on how sleep and mood affects depression. What are some practical implications of your science for people who are dealing with depression during the pandemic? And what are some things they can do based on your knowledge of neuroscience to help assuage those symptoms?
Sure. Yeah. I mean, so I think this pandemic has been a really major challenge for so many people. Of course, the anxiety over the health of their loved ones and financial insecurity and the social distancing that's happening is really tough for people. I would say that in the context of our research, the first thing that's clear is, how important sleep is for mental health, and the fact that actually that too is also very disrupted as people stay indoors and their routines are disrupted and their anxiety is affecting their ability to sleep. And so I think that suggests that kind of, thinking about the behavioral strategies that can be used is probably an important thing for people to consider. But I think also the second thing is, just as a researcher, I can see that mental health struggles are so prevalent and they're so widespread. And Patrick spoke really beautifully about the importance of reducing stigma. And I would say that, in these times where many people are maybe facing very significant challenges, as a researcher, I would say, people should feel that they're not alone, and they should feel encouraged to reach out to mental health professionals, so that they know that these are things that happen to everyone, and that are widespread, and that it makes sense to seek help when you need it.
Yeah, that does make a lot of sense, and stigma can be one of those barriers that prevents people from seeking care, and that's something that hopefully we can help to address with not only this webcast, but other work like Patrick is doing, and that you're doing right now, helping talk about these mental health conditions as a matter of fact thing. So thanks so much. And then here's an important kind of confluence between the topics today. And do you foresee a way that your discoveries that you're making in neuroscience in general can influence public policy on mental health? And do you see ways that public policy can help accelerate neuroscience to develop better treatments for people who are struggling?
Yeah, certainly. So, also I think, as Patrick mentioned, I think there's a huge importance of investment in medical research. So fundamentally, these are medical conditions that would really benefit from significant funding efforts to try and fuel research into them. The nature of research is we can't always predict what the outcome will be. And so sometimes you need to really try and push new frontiers and go in completely new directions. And so it takes a kind of robust federal funding system, such as, the National Institutes of Health administers, to really allow us to kind of make progress in these areas. So to me, that kind of pops out as an area where policy could make a big difference.
Mm-hmm. Yeah, definitely. Thank you for that. I serve on the Council for the National Institute of Mental Health, and I'm excited to see the new developments that take place every year. And I've been encouraged to see the budget for the NIMH going up each year, which is a great thing. But it needs to go up more to really address the crisis of mental health that's been going on for much longer than just COVID-19, but it's just getting worse even now.
Yeah, no, it's really wonderful, the work that they're doing. And I'll mention too, I've noticed that their website is also having lots of the National Institutes of Mental Health. That is, the director is making announcements there, particularly for people who are struggling with COVID-19. So I think that's, an amazing resource for people to be aware of also.
Great, thank you. That should help people out there to know that. We're talking about innovations in science and policy for depression treatment with two mental health leaders, Dr. Laura Lewis and the Honorable Patrick Kennedy. Dr. Laura Lewis is Assistant Professor of Biomedical Engineering at Boston University and a 2019 One Line Rising Star awardee. Patrick Kennedy is founder of the Kennedy Forum and a former congressman from Rhode Island. Patrick, what advice do you have? We'll just do a deep dive here. What advice do you have on dealing with stigma both for people that you talk to, both in their lives, in people's lives, and in the workplaces that they work in?
Well, first, to kind of get to your earlier question to Laura about what this environment may end up helping to do to improve the work that she and her colleagues in neuroscience do. I mean, we're now all racing to embrace these fantastic scientists all over the world. Every time you turn on the television, well, who is doing this research and who is doing that? And everybody's making this emphasis that science, if pursued, can protect us if we understand it and we invest in it. So just generally speaking, I think our country has a much more profound connection to something that many people might have thought was something esoteric. But, things like the Rising Star Awards that Laura won, the compelling thing that you do at One Mind when you give those One Mind awards is that it's a story. And everybody that's able to listen to it says, oh my God, they feel like they're like on the Raiders of the Lost Ark. And, they're trying to find where are the answers in neuroscience to help my loved one suffering from one of these illnesses. And it's a terrific and exciting thing. I think that's going to help us invest more into the NIH. And we should do so. On the stigma, the effects of stigma are on the NIH in terms of relative investment in mental health when compared to other institutes within the NIH. So stigma is not just, I don't want to tell anybody that I'm a person in long-term recovery. Even today, as a public figure, it's not as comfortable a subject as I would have expected it to be, given the fact that I've been at this a long time and I'm used to being in public, and so I'm used to all that, and yet it's still uncomfortable. I mean, I find even in my own family and friends, I see things that are elephants in the room, like people suffering openly in silence, but everyone kind of looks away. And I know that because that's what I went through. I know that because that's what other family members of mine have gone through. And yet I'm still holding my breath because I don't think it's more like uncomfortable. Like I don't want to get involved. And that's stigma, frankly. It's deep, it's persistent, and it's deadly, because if we don't intervene with people that we love who need help, and we just think, oh, they'll handle it, well, they may not handle it. I've had too many tragedies, both in my own family and amongst friends, that tell me otherwise, that you cannot think that things are going to get better. I went to a cousin of mine who I've been close to for my whole life, and he just lost a year and a half ago his son to suicide, 19 years old. And at the funeral, he said to me, Patrick, I didn't think it was that bad, speaking about his son's depression. And it's because he probably felt like it wasn't what should be going on, anyone's business, that he's suffering from depression, because it's got these components that we still find very stigmatizing. And that's where stigma gets in the way. If he had gotten, you never know what would have happened. But it's safe to say, in his case, Harry's case, as well as in cases all across this country, that if we had gotten better treatment to them earlier, that I think definitely could have changed the trajectory of a lot of these ultimate tragedies, which I think are really deaths because of neglect and inadequate response, than they are deaths that were inevitable. I refuse to believe that of the 48,000 Americans who take their lives every year, that those were all inevitable. I know in my heart that they we could really make a dent in that total number. And those are families that would not be suffering what they're suffering today. So
Yeah,
it was really powerful.
Patrick, I get it. I felt a lot of self-stigma about my condition, about thinking things like, am I less than a human being if people perceive me as somebody with schizophrenia? I felt that in the past, and that prevented me from talking about it in many cases. And I was very fortunate to get care early because my behavior was clearly out of the ordinary, and a friend helped me get to care. She saw how I was behaving and realized that I needed care, and she convinced me to go into a psychiatric hospital very early in my first episode. So that was great. But I think that do you see that, particularly as an example, kind of dovetailing what you were saying about the need for people who experience these conditions not to feel ashamed and to know that it's just something that we all deal with at different times in different ways, and maybe if we can express what we're feeling and not be afraid of that. I know it's hard to feel that, but if not be afraid to express what we're feeling, then that can help us all.
It's an interesting conundrum for a lot of researchers on why is there a huge increase in suicides amongst young teenagers, as well as overall amongst young people, and of course overall in the population. But it's shocking when you think about even preteens and early teens. It's up 300% in the last decade. So, and people say of social media, which it may be, there's a lot of that, probably exacerbates it. But there are benefits to how media can connect groups of people who have otherwise would not know each other and therefore feel a sense of community. And right now in this pandemic, I have a Zoom link 24 hours a day, 7 days a week for an online meeting of 12-step recovery. It's going on around the world, real time, 24 hours. I could jump off this interview and jump right on a recovery and talk to my peers and hear what's going on with them. There's something really powerful about, in this modern era, about young people and all folks being able to identify that they're not alone, and not to feel that by trying it out on their family who may be really uncomfortable, or friends who be like, I don't really want to hear about that. But you have an opportunity to go directly to an online community who all have been through exactly what you've been through, and who will give you the reassurance that you're not alone. So I think there's some value in that kind of connectivity, where there are liabilities and other aspects of modern technology.
Yeah, that's a wonderful, wonderful to know that those supports are out there. People can access those. Thanks for sharing that. Laura, so in this pandemic, as we described, we're all facing challenges to our emotional well-being. What do you see as some of the biggest mental health challenges ahead as the pandemic starts to wind down and the fallout maybe increases in our mental health space? What do you see as the biggest challenges?
Yeah, well, I think there's kind of two parallel ones. One is, the really severe immediate impact of the pandemic itself on how people are feeling, the stress of kind of, job loss or health worries, or all of the instability that's coming with this. That alone is such a stressor and a trauma. But I think a second really big concern is access to care. So especially, as you mentioned, the role of a friend in helping you find the help that you need, as people are falling out of touch with each other, or as it may become very difficult to get an appointment, as therapy is moving more and more virtual, whereas that was less common before. These are all really big shifts, and so I think making sure that people have ways to connect and to kind of get the care that they need is going to be really critical in terms of trying to recover from this crisis.
Okay, that is very important. Thank you. And Patrick, when we as a nation are past this pandemic, what would you like to see happen in the mental health arena going forward?
Well, I'd love to see every aspect of our society embrace mental health as part of the overall health that they fight to keep, protect, and expand. So we're seeing changes. I think in a political lens, because I think the best way to take these changes to scale is to have good, informed public policy. Because if we, for example, write into the Elementary and Education Act that we expect social emotional learning, problem solving skills, coping mechanism development, mood regulation skills, all that to be included in our education system, so our kids will know how to mediate their emotions and deal with stresses and know how to work through stressful situations. That's something that I think would really blow out, if you will, a whole new paradigm in terms of how we think about mental health, because now it'll be integrated into education. Then, if we totally blow out the collaborative care codes in CMS, such that all physicians know that they're going to get paid for being part of a continuum of care that includes mental health, that'll blow out the healthcare system so that, a lot more people would get treatment than otherwise would get treatment. And then if you do the other kinds of things, as I said, in our criminal justice system is really a repository for a broken mental health system. So we have to totally turn that criminal justice system upside down. It's made up of people who are victims of trauma, who have been subject to incredible adverse childhood experiences in many instances. And there'll be some that you just need to lock up because they're people that are not safe for society to be around. But I would say, a good portion of those, by the way, we incarcerate more people in our country than any other free nation in the world. A good portion of the people we've locked up today, it's a result of a bias system, not just racial bias, which certainly is a huge indicator of whether you end up in the criminal justice system, but bias because of mental illness and people being thrown into jail when really they were trying to feed their drug habit addiction, whether they were, acting out because they were in a psychosis and locked up, and then getting arrested because they're not paying their fines and they're spending all this time in jail, and in which their mental condition deteriorates dramatically as a result. In other words, there are so many things that we just need to do. We need to do, as you know, first episode of schizophrenia treatment, ubiquitous right across the country. We need to fund that. We need to fund the nurse-family partnerships, so there isn't a child in this country who's born addicted to drugs or alcohol. And the largest cause of preventable intellectual disability is the fact that children in this country are being born every day to mothers who are addicted to alcohol or to drugs and have not been able to get the treatment that would save not only them but their baby from this tragedy. So Brandon, what my vision is that the COVID crisis will make it such that everybody will be able to relate to the importance of this subject. Then the key is, okay, now you've got my attention. What do you want me to do? And that's when we have to present America with Plan A. And your dad has been, and your mom has been a great champion of that whole process. And I think if the country actually knows that there's a plan, there is a solution, then I think that it'll be more realistic for them to push that button and say, let's finally do what we should have been doing all along.
Makes sense. Totally makes sense. On that note, you and the Kennedy Forum have joined a coalition of major advocacy groups to advocate with the federal government during the COVID crisis for improving and even preserving the behavioral health care system during the crisis. Can you share a little bit about the requests that have been sent to Congress and now to Secretary of Health and Human Services, Alex Azar, please?
Sure. So, big challenge now is in being ready for this coming tsunami of need. The first thing we have to do is, like the old admonition in healthcare, first do no harm. And first do no harm means first don't lose the existing workforce that you have out there providing mental health and addiction care. And there are mechanisms within CMS to essentially pay those workers like we would the Paycheck Protection Act, right? Through the crisis, irrelevant as to what percentage of the population has declined. So they're still treating people, but obviously, like a lot of the healthcare system, they're not treating at the same numbers. But we don't want to drive them out, and because we're going to need them back on the job full force in no time. And so that's the biggest piece of this is we need to, Medicaid, by the way, is the biggest funder of mental health care in this country. SAMHSA gives out block grants, and those can be very helpful depending on how much is appropriated to those block grants. But relative in comparison to Medicaid, SAMHSA is very small. So the real big ask in the federal government for any one of your listeners who cares about advocating for mental health is making sure there's adequate Medicaid funding. Now, we want Medicaid expansion. We want expansion of reimbursement for states with Medicaid. And of course, we want these additional provisions that will allow local state directors to keep their populations of healthcare and mental health care workers held harmless in this crisis, because we're going to need them in short order. So that's been the big piece. And amongst that, there's a whole list of other things that we're asking for, but preservation of the workforce is the most important thing right now.
Yeah, that's so key, because so many people are needing the help right now, and I mean, they'll even more will need the help after the pandemic as well. Thank you for the work you're doing along with One Mind in that coalition. Thank you.
Yes, and I'll just add that, the telehealth, we talk about parity, which is trying to provide for mental health services on a par, on equal basis as you would medical or surgical. But we have another parity problem, and that is, are we paying for telemental health or telehealth in general the same as we would healthcare? And our country has not turned that corner yet. And if we're going to pay for the same clinical treatment, and frankly, a lot of people see that online telemental health is as effective as telepsychiatry, as regular in-person visits, then we should be paying for it the same way and the same amount. So there's that tele piece. And a good thing about COVID-19 is it kind of helped us blow out a lot of the small state kind of barriers to preclude the doctors across state lines from prescribing. Still need to do more of that, kind of opening up these barriers. There's just a lot we need to do as we change the way healthcare is delivered in this country.
Indeed. It's good to know that telemental health is starting to expand. Some of those restrictions are being relaxed so people can still get the care. And this may turn into something that enables more people to access care, even if they're remote, even if they can't reach a clinic, if these relaxations on restrictions continue into the future, which I think they should.
Yes.
Thank you, Patrick. So to sum up, Patrick and Laura, first Laura, what are some key takeaway points you'd like viewers to remember about innovations in depression treatment and how they can help people today?
I guess the scientific takeaway, I would love for people to remember that there's really real and strong biological links between the kind of the rhythms in which we sleep and the health of our brains and our mental health. And so, more people being aware of that, I think would be a wonderful, wonderful thing in general. And then maybe a sort of bigger picture takeaway would be, I know this is a really difficult time, and I would like to say I hold a lot of optimism still. I think there's really, I see the kinds of research people are doing for COVID, and I also see the kinds of neuroscience advances that are coming out in the field, and I hold strong hope that there's so many people working so hard to try and improve things. And so I want people to kind of to know that all of that work is happening.
Definitely, you're one of those people for sure. They're on the front lines of improving brain health care through the research that you do. Thank you. And Patrick, what are some key takeaway points that you'd like to reiterate?
Well, I'm so impressed with Laura, your work. And I'm here in my kitchen with my 12-year-old daughter. And, sleep is a big issue. And, you can see the mood swings throughout the day, and they correlate to how much we slept at night. And they also correlate to how many other stressors we have in our lives. And right now, our youngest, our 2-year-old, is having a nap. And boy, he's a lot happier after his nap than before his nap. We're all, in my view, a little bit of big children. Like a lot of these things are still with us, and we all could use to deal with our stress. So I would say to folks, exercise. If you're able to work out in any shape or form and work up a sweat, do that. Get sleep. Try to eat regularly, and don't do what I do, and that's binge on vanilla ice cream with cream and chocolate sauce. But the laughter is important too, and hopefully with social engagement with friends and family, we can lighten the mood a little bit. But those are the elements: having love, having sleep, having food, having exercise. These are the components that I think make you more resilient. And being able to see friends on Zoom like this is very helpful. And to see the smile on other people's faces, very helpful. So thank you, Brandon, for hosting this, and great to be in your army and soldiering on, and Laura, to be with you and One Mind and all of that they do. So thank you for everybody watching, and please stay tuned to Brandon and Brainwaves and One Mind.
Thank you very much, Patrick, for that shout out, that vote of confidence. Really means a lot. Yeah, indeed, dear viewers, thank you so much for watching and participating today. Thank you so much, Patrick, for your time, and Laura, for your time appearing today. You've said things that are going to inspire people and help them. Please be sure to tune in next week for a great episode, pre-Mother's Day episode featuring mother-daughter advocacy duo Cinda and Linnea Johnson. We'll profile about how the mother-daughter relationship has really helped improve the mental health recovery of Linnea, and as an example for so many families. And also, please stay tuned for, in the near future, a major mental health concert event on many social media platforms, which One Mind will be a key sponsor. More on that in this space soon. Everybody, if you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, the Disaster Distress Helpline provides 24/7, 365-day-a-year crisis counseling. Call 1-800-985-5990 or text "Talk with Us" to 66746 to connect with a crisis counselor. Thank you. And if you have any questions, you may follow up on onemind.org/brainwaves over the next few days, where we will do our best to answer your questions there as well. Everybody, thanks so much, and talk to you soon.